I'm on the website of Ministry of Health and Family Welfare, Government of India, and the current number of active cases in the country is around 27 lakhs. The number of discharged patients has risen to 2.4 crores. The number of deaths is upwards of 3 lakhs, and the total number of vaccination that has been provided is about to reach 20 crores. Now, these numbers are good, but with every passing day, we find someone or the other is getting infected. Some place or the other is having an outbreak. There have been cases of black fungus, there have been current cases of white fungus, and so much is going on around the country. Amidst all of this, last week, the Indian Council of Medical Research, the ICMR, approved the first self-testing kit of the country. And this was like a ray of hope, one might say. And this simply means that while sitting at our homes in our own comfort, we can test ourselves for the SARS-CoV-2 virus. Now, what we'll be doing in this video is that we'll be reviewing the video which was released by My Labs, which is a Pune-based molecular company, which is also the developer of the self-testing kit that we're talking about, which is called Coviself. Okay, so let's get right into it. So we'll start the video and you'll be able to see it over here along with me, and we'll see and we'll discuss some of its pros and cons and what all possibilities that does it bring with itself.
Dear Coviself user, welcome. Today we're going to perform the Coviself COVID-19 antigen test. This is a self-test kit. Let me walk you through on how to use the kit. Let's get started. First, it's important that you find a clean place to do the test.
So this is actually very important, finding a clean place to do the test, because it helps, it prevents you from contaminating any of the contents which will be provided in the self-testing kit. Let's get right.
Identify a table and sanitize the surface thoroughly. Wash your hands with soap and make sure your hands are dry before you perform the test. Now let's tear the pouch and see the contents of the kit. Lay the contents of the kit on a table and I will walk you through them one by one. This is the instruction manual. This is a pre-filled extraction tube.
Now the pre-filled extraction tube that is spoken about here is actually filled with a solution which will inactivate the virus, and it is designed in a manner that will help us to control any kind of biohazard which can be caused due to the virus. So it contains a solution that will inactivate the virus and also minimize the biohazard possibilities.
This is a sterile nasal swab. As you can see, it has two sides. One is the plastic side and the other one is the paper side.
Also, when you see the swab, the design of the swab, one side is plastic and one side is paper. Now, the swab is also designed in a way that it is designed for biocontainment, so that the virus that is there on the swab when you test. Suppose you're positive and you test positive for the virus, and the virus is there on the swab. It is designed in a way that it can contain the biohazard.
One test card. This is a biohazard bag.
Again, the biohazard bag is also designed so that any kind of biohazard can be prevented, because you do not want that after testing, if you test positive and you dispose the contents of the bag, the virus spreads through the disposable items. So let's.
Before you proceed with the test, please download the My Lab Coviself app either on Google Play or App Store. Fill in the credentials and then proceed with your test. The test preparations are now complete. Let's begin with the test. Take the pre-filled extraction tube and tap it gently 3 or 4 times to ensure that the liquid settles at the bottom. Unscrew the cap and hold the tube in your hand. Open the sterile nasal swab while holding the tube in your hand. Tear it from the tail end. It's important that you do not touch the swab head. Carefully insert the sterile nasal swab in both your nostrils, one after the other, up to 2 to 4 centimeters or until resistance is met. Roll the swab 5 times inside each nostril. Your nasal swab is now ready for the test. Dip the nasal swab sample in the pre-filled extraction tube. Pinch the tube at the bottom and swirl the nasal swab well. Make sure the swab is immersed in the liquid. Find the break point and break the swab. Cover the tube with the nozzle cap and tighten it. Take the test card and add 2 full drops into the well by pressing the tube. Wait for 15 minutes for the results to appear. Any results appearing after 20 minutes are considered invalid. At 15 minutes, the MyLab Coviself app will raise an alarm. The software has an intelligently designed AI which gives accurate results. You can now download your COVID-19 report from the link. For negative results, if there's only a quality control line C and no test line T appears, it indicates the coronavirus antigen has not been detected and the result is negative.
So the artificial intelligence which is mentioned over here is nothing but, what it does is that it tells you your positive or negative status by reading your test card, and after that it sends the same data to ICAIR, for traceability purposes. And after that, when that is all done, it sends you your certificate of positive or negative. So that is how the AI works over here. It automatically coordinates all of these things and gives you the final test results.
For positive results, if both the quality control line C and test line T appear, coronavirus antigen has been detected and the result is positive. Finally,
so in short, what you need to do is once you get your result, suppose you get a negative result. Cool. So negative result can be obtained in 2 cases. One, that you have not been affected by COVID virus at all. Or secondly, if your viral load is low, or maybe you're showing no symptoms, or sometimes because of contamination of the swab, or the process has not been done as it's supposed to be done under ideal conditions. So what you can do is, if you're still having symptoms, then you can go for an RT-PCR. Cool. So you do not need to go for an RT-PCR if you do not have any kind of symptoms and you have tested negative over here, it's fine. But then if you are having symptoms, if you still feel that yes, somewhere or the other you feel like you have had an interaction, a strong interaction with someone who has been detected out of COVID, then you can go and have an RT-PCR test as well.
Take all the components of the test and discard it in the biohazard bag provided.
Okay, so that was a great description. They told us everything about everything about the app as well as everything about the self-testing procedure that we needed to know. Now comes the main point, is that how will this be helping us? Now the thing is that if you are testing for RT-PCR or a rapid antigen test in any part of the country, the prices vary from anywhere related to the upwards of 300 or 400, and they may go up until 1,000 or a 1,500 price margin. Now that is where this plays a very immediate as well as important role, is that it cuts off that price and makes it available for everyone to test themselves at home if they are having any kind of symptoms. Secondly, there has been a lot of workload on the testing labs because of the because of so many people wanting to get their RT-PCR. Suppose you're traveling from one city to another and you need an RT-PCR test and you need it quick. Cool. So if you need a negative test, then this test cannot be used for screening. By the way, after you have done the test and you are positive, you cannot go here and there. You have to follow all the regulations. The positive over here means you're positive. It's like a confirmatory test. You do not need to do an RT-PCR after this. So yeah, it helps in both the ways. It decreases the workload on the healthcare providers as well as it gives everyone an opportunity to check themselves for a lower price, which is available at your home as well. Now, this test kit, the current production, numbers that suggest that, currently MyLab can produce almost 70 to 90 lakh units per week. But, they are willing to expand this, and they're willing to, support India by providing millions of such test kits in almost 7 lakh chemists and e-pharmacy portals in India. So this it will be available almost everywhere. So if you're a pharmacy owner, if you're an e-pharmacy owner, you can go to their website and there is an option of placing bulk orders. Secondly, if you are someone who's looking forward to testing yourself at home using the Coviself, then it will be available by the end of this week, and that's why we're making this video right now, so that you know anything and everything that is needed to know about such tests. Talking about the importance of it, it decreases the workload, and it is very economically feasible for everyone to try it at home. Whoever is having the symptoms, of course. Secondly, while using it, make sure that you have maintained sanitation across, throughout the procedure. Your hands are washed properly, they are dry, you are using a clean table, so that all these measures are just to avoid any kind of contamination on the swab or during the test, because that may result, if you're positive, sometimes maybe due to some circumstances, due to some contamination problems, you might be shown as positive or negative when you will be otherwise. Next is that we learned about how to test yourself. Why is this important? What will be the price? The price will be anywhere around 250 rupees. That's what has been suggested by my lab. And I guess that is a very reasonable price, because the other, as I said before, the other tests are going anywhere around 300, 400 till 1000 to 1500. So 250 is a very good price. Next up, there are a lot of people who are arguing against it, simply because somewhere or the other, they feel that what if the app does not work in the same way? Then again comes the same, old argument that, AI might not work in the same way that we are thinking it to. Maybe someone gets something else. Maybe someone inputs the wrong address or the wrong details, so the traceability does not work. Maybe, a lot of things. Someone might be negative, their test cases show positive. Okay, all these things are there. What I'll say is that nothing which is available in the market, none of the tests that are available in the market is 99% or 100% record. Okay, so sometimes you'll have to give it a try. This is a very big ray of hope in the medical field or in the healthcare field, I must say, because the cases are rising. There are second waves and people are talking about third wave, fourth wave. So we have to, bring it down. We have to prevent any further waves. We have to stop the current one as well. And towards this, endeavor, this is a very big step. So, at the end, I would just like to say that, Coviself is a very good, device or a very good plan to give everyone the power to, check themselves. And you're positive, then please make sure that you're, at your own homes. You do not go here and there. You maintain the protocol. And for the others who test negative as well, do the 4 things which are required: get vaccinated, maintain social distancing, sanitize your hands whenever you go out, sanitize your packages and whatever is coming to your home from outside, and wear a mask. So thank you everyone for staying there, and I hope that this was helpful. We almost covered everything that there is about Coviself, and at the end, I would just like to say thank you for watching the video. And if you like the content, then we are putting in a lot of efforts to put through content which is related to health tech, upcoming trends in healthcare industries, and a lot of things like AI and machine learning. All of these things are seeping into healthcare slowly. So we're trying to bring all of this into picture. And your support would mean the world to us. So thank you for watching this episode. If you like this, then like, share, and comment. Also follow our channel for more such updates. Thank you. Jai Hind.